and welcome to week 2. This week we will be covering chapters 3 and 4. This week's objectives include being able to define the terms epidemic, endemic, pandemic, epidemiology, and epidemiologist. We will also go over some diseases that caused epidemics in the past and some that are causing epidemics today. After this lesson, you will be able to define incidence and prevalence rates and provide examples of each of those. We will also define the following standard measurements of health status, which include life expectancy, years of potential life lost, disability-adjusted life years, and health-adjusted life expectancy. We will also go over the differences between a communicable disease and non-communicable disease. And we'll talk about how communicable diseases are transmitted using the chain of infection model. Then we will talk about the differences between the prevention models, which include primary, secondary, and tertiary prevention, and talk about the importance of preventing and controlling the spread of communicable diseases in the community. The assignments that will be due this week, one is the type of prevention wiki, prevention plan for measles, chapters 3 and 4 quiz, and the discussion board. I'm going to go over the 2 assignments briefly. The types of prevention wiki, the purpose of this assignment is really to help you gain a better understanding of the 3 types of prevention. Again, primary, secondary, and tertiary. You will apply your understanding of these types of prevention to a case scenario. For how you're going to complete this assignment, review chapter 4, especially the levels of prevention. And make sure you pay attention to primary prevention, secondary prevention, and tertiary prevention. On the assignment, I've also defined each of those types of prevention. For the what, this is what you will be doing. So pretend that you have been assigned to reduce either communicable or non-communicable disease in your community. I want you to choose something that you are interested in looking into. You can do lung cancer due to smoking, although I do have that example. You can do diabetes, cardiovascular disease. Since we're in flu and cold season, maybe you want to talk about the flu and cold. But pick one type of either communicable disease or non-communicable disease to write about. Once you come up with it, you're going to give examples of the 3 types of prevention. So the example I have here is lung cancer due to smoking. The 3 types of prevention plans that I have come up with: under primary prevention, I'm going to have tobacco lessons targeted at youth in schools before they smoke to teach them to say no to tobacco. That's primary prevention because I'm identifying the problem before it becomes a problem. Secondary prevention is when the problem initially starts. So for this example, my program would be to offer smoking cessation programs at work to help employees quit smoking. And smoking cessation programs are programs to help people quit smoking. Tertiary is when the disease or problem is a problem. It's advanced and disability could occur, disability is occurring. So tertiary for this example would be medical treatment for lung cancer because it's at the advanced stage. The next assignment that you'll be completing is called Types of Prevention Measles. Again, the purpose of this is just to get more practice in the areas of prevention, primary, secondary, and tertiary. What you're going to do is, again, you can review chapter 4 in your textbooks, review the types of prevention. You can also review the Prezi on measles that is located in Blackboard to give you an idea of how measles spreads. In addition, I provided a couple websites to help you get more information on measles. And then third is you will conduct an internet search on measles outbreaks in your area. So most of you, I believe, live in Cook County, Illinois. So you can just type in the search terms measles outbreaks in Cook County, Illinois. There are 3 ways you can choose to present your information. You can do an essay, you can create a PowerPoint, or create a document with bullet points. Regardless of how you choose to present your information, you must contain the following information. So who does measles affect in the area? Which populations are more susceptible to the disease? How would you describe the seriousness of the disease? And for this, I want you to back it up with facts. Is it serious in your community or is it not? And tell me why. How does the disease spread? How contagious is this disease? And then what prevention model would you use to eradicate or get rid of this disease? Would you use primary, secondary, or tertiary? Tell me why you chose it and how you would develop a prevention program for that particular type of prevention. So now we're going to get into the chapter 3 and chapter 4. So some of the terminology you will need to know. Epidemiology is population medicine, so study of diseases at a population level. So therefore, an epidemiologist is concerned with the course of a disease population. They collect information about disease status of a community, and some of the things they look at are how many people are sick, who is sick, are there certain people in the population that are more susceptible, when did they become sick, and where do they live. And then data is used to prevent disease outbreaks or determine effectiveness of prevention efforts to see how well they have worked. Other definitions you need to be familiar with. So again, epidemiology is the study of the distribution and determinants of health-related states or events in a specified population. Essentially, that's the study of disease in a population. An epidemic is an unexpectedly large number of cases of an illness, specific health-related behavior, or event in a particular population. An endemic is a disease that occurs regularly in a population as a matter of course. And then pandemic is an outbreak over a wide geographic area. So pandemics are usually used to describe diseases that occur in a country, on a continent, things of that nature. So a large geographic area. When we talk about the importance of rates, rates can be used to see if prevention programs are working, how many people are being infected with an illness, and so forth. So they really allow for the comparison of outbreaks at different times or in different places. Some of the numbers that they look at are cases, how many people are affected by the disease or how many people are sick. Rates are the number of events in a given population over a given period of time or a given point in time. And some of the things they look at are nationality, morbidity, which is sickness, mortality or fatality or death rates. And then population at risk are those who are susceptible to a particular disease or condition. So it's the population that's at risk for getting sick. So there are 3 important terms we'll talk about here. So incidence, prevalence, and attack rates. An incidence rate is the number of new health-related events or diseases or sicknesses divided by the population at risk. And so this tells us how many people are getting sick and at what rate getting sick. And then attack rate is the incidence rate calculated for a particular population for a single disease outbreak, and it's expressed as a percent. So what percent of the population is being affected by those diseases? A prevalence rate, so let me just clarify. Incidence is the number of new cases. Prevalence is the number of new and old cases in a given period of time. So prevalence rate tells us how many people are impacted or affected by that disease. Incidence tells us how many new cases there are. So here are just some equations for the different rates that I just spoke about. You can see, so incidence is the number of new health-related events of a case or a disease divided by the number of people exposed. Attack rate is the cumulative or the total number of the infection by the number of people exposed. And prevalence is really the number of all individuals who have the disease divided by the people in that population. The two, if I were to tell you to remember 2 of these, the 2 more commonly used rates are incidence rate and prevalence rate. Again, incidence rate is the number of new diseases, whereas prevalence rate are the number of diseases total, new and current. So when we look at how to interpret these rates, so incidence and prevalence rates are usually expressed as either crude or specific. So a crude rate is a rate in which the denominator includes the total population. Age-adjusted rates are used to make comparisons across groups over time when groups differ in age structures. So maybe those in their 20s or those in their 60s. Generally, the older population is more at risk just because their immune system is not as effective. So you often see age-adjusted rates being used for the older population or the real young, where diseases are more dangerous for those groups. We have mortality statistics, which is really one of the most reliable measure of population health status. So how many people are dying? What's the mortality rate? And life expectancy is the average number of years a person from a specific cohort is projected to live. So in this table, if you look at this left side, at birth, this is telling us what is the life expectancy. So in other words, what is the average that people live for? So you can see here in 1900, for both sexes, the average life expectancy was 47 years old. If you look at 2013, the average life expectancy is 78 years old. So there has been a huge increase in life expectancy from the 1900s to 2013s, even from the 1950s to the 2013s. One thing you will also notice is that generally women tend to live longer than men. As you can see here, from 2013, the life expectancy for men was 76.4 years old, whereas for women it was 81.2 years old. We look at years of potential life lost, which is the number of years lost when death occurs before one's life expectancy. So for example, I'm going to go back for 1 second. So for example, in 2013, the life expectancy for females, let's say it was 81 years old. If my life expectancy is 81, but I died at 65, then their potential years life lost would be, now I'm doing math in my head really quick, about 16 years. So 16 years of potential life loss. So it really weighs the death of a young person is counting more than the death of an old person. And the reason is if someone dies at 40, they're losing a lot of their productive years in life in terms of being in the workplace and contributing to society. Whereas if you lose someone at 75, they have already probably finished working, they're retired. So it doesn't weigh that heavily on society compared to someone who is younger that dies. So to determine a lot of these, there are epidemiological studies, and these are investigations or studies that are carried out when a disease or death is occurring in an unexpected or unacceptable number. So to try to explain what's going on that causes increase of diseases. There are descriptive studies, which really just describes the disease. So it uses, who's getting sick, what's the place, what's the area, what's the environment where the sickness is occurring, and time could be how long is the illness, or it could be a period of time, so 2020. Analytic studies, these are ones that are aimed at testing a hypothesis. So there is some sort of idea that scientists have as to what's causing the disease and testing out that hypothesis. So the studies really describe what is going on. So who, the case count, how many people are getting sick? Are there different populations that are more susceptible? Children, men, women, race, etc. When? So when does the disease start for each case? And then epidemic curves are created. Also where? So this could be an area, it could be travel, it could be a store, people are visiting a store and then getting sick. So they're trying to really describe what is going on. That's why it's called descriptive, to describe what's going on. For analytic studies, there are two main ways that this is carried out. One is an observational study. So investigators observe the natural course of events, noting who's exposed versus who's not exposed, who's getting sick versus who is not getting sick. Experimental studies are when investigators or scientists allocate exposures and follow the development of the disease. So in experimental studies, it's really done to identify the cause of disease or to determine how effective a vaccine, a drug, or prevention procedure is. When we talk about experimental studies, you often see the word placebo. Placebo is a blank treatment. So for example, let's say there is a flu outbreak and there's this new drug to treat the flu. So it's the pill, the flu pill. What they would do in experimental study is they would take that population of those who are sick. Half of them would get the flu pill and half of them would get a pill with just water. And they wouldn't tell which people got which pill. And they would do the treatment course. After the treatment course, they would measure the effectiveness and compare those that received the flu pill to those that received the placebo pill to see if there's any difference. There's something called the placebo effect. And generally, when you give someone a treatment and tell them it's a treatment to fix whatever disease or sickness they have, those people tend to feel better. And that's called the placebo effect. So there's nothing in that pill to make them better, but it's telling them that there's something in the pill to make them better that truly makes them feel better. When we look at determining causation, this is what is causing the sickness or disease. And so some of the criteria for determining causation is the strength of the bacteria, virus, whatever it is, the consistency, specificity, temporality, and biological plausibility. In community health, diseases are either classified as acute or chronic. Acute is generally 3 months or less that you're sick, and chronic is generally over 3 months that you're going to be sick. And communicable diseases are those that you can catch from other people, whereas non-communicable diseases are those you cannot catch from other people. So communicable diseases usually are caused by a biological agent, so a virus, a fungus, bacteria, protozoa. There's usually some sort of bacteria or microorganism that causes the sickness that is able to be passed from person to person. Whereas non-communicable diseases cannot be transmitted from person to person. So an example of a non-communicable disease, let's say it's breast cancer, right? So if I have breast cancer and cough on someone else, they're not going to get breast cancer from me. It's a non-communicable disease. And unfortunately, identifying the cause for non-communicable diseases is often very difficult because there are many factors that can contribute to the disease progression. So take example, my breast cancer. Perhaps it's a genetic component that I had and I'm more susceptible to breast cancer. Or I was exposed to some toxin as a child that made my cells mutate, which caused my breast cancer. It's really hard to determine what factors contributed to those diseases. So acute versus chronic. So acute is short-term, whereas chronic is long-term. So acute diseases can be communicable or non-communicable, right? A cold is generally an acute disease. The flu is an acute disease. Chronic diseases, again, can be communicable or non-communicable, tend to be longer in length. So cancers would be considered chronic, cardiovascular disease, diabetes. And then there are also some communicable diseases that can last a long period of time as well. When we talk about the infectivity, it's the ability of a biological agent, so a virus, bacteria, to enter and grow in the host. So the agent is the cause of a disease or health problem. So in terms of communicable, that would be the virus or bacteria. The host is the person, so it's the susceptible person or organism invaded by that agent, so invaded by the virus or bacteria. And environment are factors that inhibit or promote that disease transmission. So an environmental factor would be if I am immunocompromised, if my immune system is not working as well as it should, that makes me more susceptible to getting a certain disease. Pathogenicity is the capability of an agent, so that virus or bacteria, to cause a disease in a susceptible host. So truly, how strong is that virus or bacteria? And obviously, we are exposed to many virus and bacteria every day, and our body's able to fight it off and we don't get sick. The stronger a virus or bacteria is, the less effective our immune system is in killing it off. Here are just some examples of biological agents of disease and the different categories they fall into. And again, when we look at the communicable disease model, there are three ways we look at it. We look at it from the host, that's the person susceptible. The agent is the virus or bacteria, and then the environment are things that inhibit or promote that virus or bacteria to grow in our body. So here's a model. It's called the chain of infection. How does someone get sick? And this is for communicable diseases. So there has to be the pathogen, which again is that virus or bacteria. The reservoir is where that pathogen is living. Then there's a portal of exit. So if we're talking about the common cold, the pathogen is the cold virus. Let's say it's living in me, so the reservoir is me. And then the portal of exit, if I cough, I am releasing that virus into the air or onto a desk or something like that. The transmission is, how does that now leave my body and enter somebody else's body? So how is that transmitted? The portal of entry in a new person is how that virus or bacteria gets in the new person, and then the establishment of infection, the new host. The new host gets sick from that infection. So again, here is the model of the chain of infection. You can read through this on your own. But again, this is how communicable diseases are spread from person to person or from animal to animal, if we're talking from animal perspective. There are two modes of transmission. There's direct transmission, which is the immediate transfer of a disease agent between infected and susceptible individuals. So this is where we're generally sharing fluids with other people, right? So we're touching, biting, I don't know where that came from, but kissing, sexual intercourse, right? There is a direct exchange of fluids, and that is direct transmission. So it's a direct transmission of fluids. Indirect transmissions, there's some middle step there. So airborne or vehicle-borne or vector-borne or biological. Airborne is I cough in the air, my cough drops, spits, have the virus, someone breathes that in, that would be airborne. Vehicle-borne could be I cough, the virus is now on the desk, the new student comes down, sits at the desk, touches the desk, and then touches their face, their mouth, or their eye. The virus enters that way. Vector-borne, it could be like a mosquito bite. Mosquitoes are the intermediate part. And so vehicles are, well, non-living objects by which the agents are transferred to a susceptible host. So my example of coughing on the desk, and then the student coming and touching the desk and then touching their eye or their mouth, the desk would then be the vehicle of transmission. So here's just another example of how a communicable disease is spread. So we'll use the example of the cold virus. So the agent, therefore, is the cold virus. It leaves the reservoir of a person. So for this would be the throat of an infected person when the person sneezes. So the portal of exit then would be the nose and the mouth, right? Because when you sneeze, droplets come out. For this, the direct transmission would be the saliva droplets that enter the respiratory tract of a susceptible host. So that means that the infected person sneezes, the droplets are in the air, the next person, the susceptible person, breathes in those droplets. So now it entered the respiratory tract of the susceptible host at close range. The portal of entry is the mouth because they brought it in through their mouth. And then the new infection is possibly established. We look at this because if you can remove one of these links, then the chain is broken. And that means that the disease cannot be spread. So for example, let's say I'm going to break the link at transmission. So I'm breaking the link right here at the transmission link. what you could do is have those people who are infected wear face masks. And so what that does is it prevents the infection, the agent, from leaving the host, right? So it's leaving the host, but it's getting caught up in the face mask. And therefore, there's no portal of reentry because it's being blocked by that face. When we look at the non-communicable diseases, again, these are diseases that you cannot catch from person to person. In America, the nation's leading cause of non-communicable disease are heart disease, stroke, and cancer. And these have really complex etiologies, which means really complex causes, right? If you think of heart disease, some of the risk factors could be genetic, meaning that there's something in the genes that makes a person more susceptible to heart disease. It could be diet. What kind of foods are you eating? It could be your fitness level. Are you exercising or are you not exercising? And there's many other risk factors and possibilities. So we look at the multi-causation disease model, meaning that there are many possibilities to causing these diseases. So you have to consider the host, so the person where this occurs, right? There's some inalterable, unique genetic components that either make you more susceptible to a disease or susceptible, and you can't change it. It's what you're born with. We look at personality. Are you a risk taker? Are you, having lots of unprotected sex? Are you eating foods that are not good for you? Or do you live in sedentary or inactive lifestyle? Your behavioral choices. Do you smoke? Are you a heavy alcohol user? Do you use illicit drugs? All of those impact the host, right? It makes you more susceptible to disease. And then in terms of environment, where we live impacts our health. Am I living in a place that has lots of toxins that is, possibly causing my cells to mutate? Am I living in a place where there's no clean water? All of those impact how susceptible you are to a non-communicable disease. So here's just a visual of the multi-causation disease model. So that middle circle is your genetic material, right? It cannot be changed. That's who you are, it's what you're born with. The circle around it is your personality, beliefs, and your behavioral choices. And then we look at the furthest circle, and these are things that are around us, right? So our environment. What is the healthcare system that we are living in? What kind of access do you have to healthcare? The water quality. What kind of infectious disease outbreaks are in our immediate area? Air pollution, economics. Generally, right, the more money someone has, that they tend to be healthier because they have access to more quality healthcare systems. So we look at diseases of the heart and blood vessels. So this makes up the two most common non-communicable diseases in the U.S. You have coronary heart disease and cerebrovascular disease, which is stroke. We have malignant neoplasms, which is cancer, chronic obstructive pulmonary disease, which is in your lungs, diabetes, and chronic liver disease and cirrhosis. So these are the most common non-communicable diseases in the U.S. So how does one determine which non-communicable disease to focus on and to really put prevention efforts into? So the criteria that is generally used to determine what disease to focus on is what are the number of people who will die from that disease, right? So we look at the leading causes of death. What are the numbers of years of potential life lost? And again, generally more value is placed on diseases that hit younger people because them dying earlier has a larger impact on society than for those who die later. And then, of course, the economic costs associated with diseases. How much money does it cost, to treat the disease or to find the disease, right? So you want to look at things that generally are really expensive to treat, so it brings down the cost. When we look at the prevention, intervention and control and eradication of diseases. So prevention is planning for and taking action to prevent or to forestall, to delay the onset of a disease or health problem, so prevent it. Intervention is something that you are doing to control the events, right? So an intervention could be smoking cessation programs, right? It's an intervention to stop people from smoking. And then eradication is the total elimination of a disease from human population. So one of the areas where we have really succeeded in this is smallpox. So there, in the US, there has not been a case of smallpox. We have eradicated it. However, it's not completely eradicated, as there are still susceptible countries and areas that still suffer from smallpox. So today, this week's homework assignments really deal on the levels of prevention. So primary prevention is to forestall, to delay the onset of an illness, or to prevent it completely. So smoking prevention programs to prevent people from ever smoking. Alcohol programs generally are trying to either prevent people from drinking alcohol or to delay the onset of drinking alcohol. And research shows that the longer a person waits to drink alcohol, the less likely they will suffer from problems from alcohol. So really, prevention programs are aimed at just delaying the onset of a person drinking alcohol. So for example, high school students, really to encourage them to delay drinking alcohol until the age of 21. Secondary prevention is the early diagnosis and prompt treatment before the disease becomes a disability or leads to death. And then last is tertiary prevention. So at this, the disease has totally progressed. We're at the end stage, and it's just really to treat it at the end stage. So strategies for primary prevention of communicable diseases. There are primary prevention strategies for each of those links. Remember the chains. So for individuals, it could be teaching about proper hand washing techniques, using condoms, properly cooking your food. All of those are primary prevention aimed at individuals. For communities, we have the chlorinating water supply. Then we have people inspecting restaurants to make sure they have clean and sanitary practices. Immunization programs for all citizens. Solid waste disposal. So all of these, again, are aimed at preventing the disease in the first place. When we think about primary prevention, immunity plays an important role here. And there are two types of immunity. One is active immunity. So this occurs when someone's exposed to a disease, which prompts your immune system to develop antibodies against that disease. When I was a child, there was no chickenpox vaccination. And so kids got chickenpox, which prompted active immunity, right? So my body responded to that virus. And now when I'm exposed to chickenpox virus, I will not get it because I have the antibodies against that disease. That would be active. Passive is when a person receives antibodies against a disease rather than their immune system producing them. All right, so secondary prevention of communicable diseases. So this is prevention aimed at the start of a disease. We look at individual, we have self-diagnosis, self-treatment with home remedies, antibiotics prescribed by a physician, those sorts of things. So the disease or sickness just started and you're teaching people how to treat themselves. For communities, it could be just having really good records on who's getting sick, where they're getting sick, investigating cases. If there is an outbreak of food poisoning, right, they would investigate where it came from and then shut that down to prevent more people from getting sick. So some of the factors that they use are isolation, quarantine, and disinfection. I always think about like the romaine lettuce, right? Because every so often there's a contaminated batch of romaine lettuce and they pull it from all restaurants and all food eateries. So that would be considered secondary prevention. So they identify the cause of the sickness and then remove it so people are no longer exposed to it. So tertiary prevention, again, so this is like last stages of the diseases or diseases really impacting the person. So for individuals, it's trying to help them recover to full health after infection, to return to normal activity. So if this is cancer, right, so it's treatment of cancer and then doing rehab to get back to where they were before the cancer hit. When we look at from the community level, if there is an infectious disease that a lot of people died, so it's removal, embalming, burial of the dead, right? So people are not exposed to the sickness, and then just, again, reapplication of primary and secondary measures to prevent people from getting those diseases. When we look at primary prevention of non-communicable diseases, so again, diseases you cannot catch, for individuals, it could be education and knowledge about health and disease prevention. I mean, think about it, you all took a high school health class, that would be considered primary prevention. How to eat properly, exercise, driving safety. For communities, it's adequate food and energy supplies, having efficient community services, so access to healthcare, access to social services, opportunities for education, employment, and housing. All of these help improve or help delay the onset of non-communicable diseases. For secondary prevention of non-communicable diseases under individuals, we have personal screenings. So for women, starting at age 40, you need to get a yearly mammogram, having Pap smears, PSA is prostate-specific antigen tests, regular medical and dental checkups, and then using those to diagnose and treat something early, right? Because the earlier you catch something, the better your outcomes are. For communities, it could be providing mass screenings for chronic diseases. Oftentimes, there are screening programs to help that are offered free of charge to help identify early cases to be able to treat them in an early time. Provision of adequate personnel, equipment, and facilities. And then tertiary prevention for non-communicable diseases is just to support significant behavioral lifestyle change, adherence to prescribed medicines, making sure people follow rehabilitation requirements after surgery. From a community perspective, it's having adequate emergency medical personnel and services, having adequate hospitals and surgeons and nurses and ambulance services. And that concludes our week 2 lesson. Have a great week. And as always, don't forget to email me or call me or come visit me if you have any questions.